Good afternoon, I'm Dr. Brown. I'm the Medical Director for Kathy's Urgent Care. We have a clinic in Wethersfield and we have a clinic in Berlin, Connecticut. We're still going through a tough time, this pandemic. Today is January 21st. We're having 2,000-3,000 people a day pass away, unfortunately, and sometimes more. But thank God the vaccine is out. There's 2 vaccines out now, and actually some more are coming. So I have some questions from readers, subscribers to our channels. So I'm going to take a peek here. The first question is, vaccine, why should I get it? All right, well, there's some uncertainty. This vaccine has been manufactured in less than a year. People are a little leery, and I can understand that. But historically speaking, vaccines are very, very safe. And you don't see people walking around with polio, measles, mumps, rubella these days because the vaccines are that good. And there's every indication that the vaccines that are out right now, the Pfizer and the Moderna, are actually even more effective and hopefully at least as safe, if not safer. Time will tell, of course, but the preliminary data is that they're extraordinarily safe. The second question is, can I still get COVID? All right, so that's interesting. So if you get the vaccine, in theory, your body will develop immune response, antibodies and B and T cells and all sorts of things we won't get into. But in theory, if you get the vaccine, you'll get 1 shot, potentially a booster shot, depending on which vaccine you get. And in theory, you're immune for many, many years after that. We don't think this is going to be like the seasonal flu, where we have to give a different vaccine every year. However, it's early, time will tell. The next question is, can I still give COVID? Okay, so these are tough questions. In theory, if you get the vaccine, especially after the booster shot, after a few weeks, you should be immune from getting COVID. And in theory, there's historical precedent for this based on other vaccines. In theory, you won't be able to transfer COVID or COVID-19 to other people. Again, I keep saying in theory because we have 1 year of data. We don't have 10 or 20 years of data. So in theory, though, if you get the vaccine, you should be immune to getting infected. In theory, you could not wear a mask, but God knows, keep wearing the mask. Until Anthony Fauci and other people say you can stop wearing masks, let's keep wearing our masks. I think the question of whether you can give COVID to someone else after you've been vaccinated, the answer is almost certainly you can't, but because we don't definitively know that, I think you have to act as if you can. And that's why we've got to keep social distancing and keep wearing the mask. So I think we have one final question. How safe is the vaccine? We've had roughly 10 million Americans at this point receive the vaccine. We haven't had any, knock on wood, we haven't had any deaths. We've had a few severe allergic reactions that responded very quickly to appropriate therapy. So I think it's safe to say at this point, so far, the preliminary data is that it's extraordinarily safe. I myself had it. I had a tiny bit of a sore arm the next day. Most of the folks who work at my clinics have had it without any side effects. So the data we have right now, it's very safe. I encourage you to get it. If a certain percentage, 70 or 80% of the population in America gets it over the next few months, this so-called pandemic that we have now should be over. Good luck.